Assalamualaikum and very good morning. I think morning now from all of you. So today class, I will talk about how can we measure active range of motion using goniometers. So before I start showing you about using these tools, let me introduce to you what is goniometer. This is goniometer, okay? So I think it's not so difficult. I think you get this, or maybe you experience learning this during your high school time. But for this subject, we are using goniometers to measure the range of movements of human joints. So for example, like you can see from my side here, obviously will be the dummies or subject for our class today. So I'll show it to you about how can we use goniometer. So let me go very quick recaps or overview about what is goniometer. You see that, you can see from here there will be two arms where you can adjust. Okay, so basically the arms is represent the joint. This is the joint, which is the fulcrum of the joint. Okay, but the arm refer to the where movement of either origin or insertions. So you can see how can we rate this. Let me show you. You can see when I move this, so this is where your point of reference starting from 0. If you move, so usually what I did, this arm we are not moving them, so it's going to be for example, if you want to measure elbow movement or elbow joint flexion or extension, so the humerus, humerus, right? The bone in the arm is not moving. The moving is the radius and ulna. So radius and ulna will move here. So usually we use this for arm for movement. Okay. So do not read on here, because when you read here, I'm afraid you will confuse, because you couldn't find where to start the number with. So you can start. This is the point where you can refer how many angles of the joint. So you can see this is all referring to the angle of the joint. Okay, from 0, 10. So you can see actually they are. It's like a mirror. You can go in both way. It depends on what kind of movement that you want to measure. So you can see that now 0. If I move my elbow, let's say this is a flexion of the arm. So and then I stop here. I stop is refer to how the person move the joint, meaning that if we categorize them as an active range of motion, meaning that you ask them to move themselves. So now you not only try to get what of the angle of the joint the person can perform, at the same time you will see some compensatory movement, meaning that whether they are compensate with the other muscles, with other joints, to ensure that they perform the flexion, which is when you ask them to do. Now you can observe what has actually happened, because someone who have injuries, for instance, one muscle to another muscle, they move the joint, they try to complete the movement, but they try to compensate using the other joint, especially the joint that living beside to the others. For example, like adjunct muscles, like quadriceps closely attached to your hamstrings, your sartorius, and so on. So you need to have a skill to closely look what are the compensatory movement are happening, and try to reduce that while assessing using goniometers. Okay, class? Let's move on with some activities. So I just want to highlight today, because in rehab I don't put so much attention on shoulders, neck, knee, ankle, because it's not really my focus for this subject. Because first, you learn this with the other classes. Second, we have limited time of hours to focus on all joint. We may take for one semester for this particular subject. Since that rehabs, we only have limited credit hours, so I need to select which one are the most prevalent and that you can use when you are one day finished and graduate in this program. So since that I believe that we have so many joints, my focus for this class, I focus on the hip, because we believe that a lot of athletes, a lot of general population, elderly or youngsters like you all, the injury on this particular region is the most often reported, especially when talking about back pain. Okay, so back pain, when you have back pain here, so it doesn't mean that the injured area only localized or focal on that muscles. It's basically involve the whole kinetic change, means from your upper body, from your lower body, but the most closest is basically your hip, because this is where your lumbopelvic are connected. At the same time, we need to clearly understand where is our center of gravity is here, which is your navel, which is your pusat. Okay, the navel is carry our center of gravity. So anything shift due to certain reason, when you have injuries, when you carry some chronic injuries especially, you want to adjust your center of gravity, so there will be a lot of shift, although you don't see that because it's only small changes or small shift, but for the long time period when you have injury, you will notice that a lot of compensation happen, especially in this region, because where you are shifting all the time your center of gravity. So for this class, I really want to focus on this region. Okay, so the first exercise or the first assessment that I want to show you using goniometers. So again, guys, goniometers is for active range of motion. Remember this, active, I repeat again, range of motion. We don't measure anything related to passive. This is what we call passive, where I assist the movement. Another one, resistive. Resistive means I ask the person to give to react to the force. So goniometer is basically more for active. So we will ask the person to move. Let's say move the hip. Yeah, this is what we call active range of motion. Then we use goniometers. Okay. Second, before we measure this, because you know the goniometer, as I mentioned, this is the diaphragm of the goniometers. It's basically referred to the fulcrum. I believe you learn fulcrum in biomechanics class. Fulcrum is the center of the joint, where connected between the origin and the insertion of the muscles. So if we want to measure the hip, so because I measure hip and I defocus on my class hip, because hip is considered as more flexible joint. It involves abduction. Let's take a look. This is abduction. It involves flexion. When you bring this, we don't have table. It involves extension. Go to the back. And that is for low level. Low level means you involve lower limbs and upper limbs. So there is another way, we should call it short level. So this is where you can do also flexion. You can do someone move like this, ask like this, external rotation. You go inside internal rotation. You see that our glenohumeral joint, especially on your hip, because it go like this, so they have a really complete range of motion. That's why I want to focus on this region instead of knee, ankle, because you learn this with sport injury subject, as well as the shoulder. If for shoulder, I believe also I need more hours, I need more time to focus, because it may take for one semester to learn and how can we prescribe exercise on that. So leave it there. I just want to show you. The first is we will ask the person to move. Okay class, alright, let's move with first exercise. So we will ask the person to move the hip flexion. Okay, alright, and go down. Okay, where can you place the goniometers? So basically you need to find the joint, because you know that, as I mentioned, fulcrum should be the center of the joint. So you need to find the joint. Okay, especially the glenoid joint. Okay, glenoid joint, which is the bone of the hip where they go into like a ball and socket, and then you need to find the most medial area of the joint, where basically you can feel it, where the movements will start and begin. So then you can put the fulcrum like this. Okay. So how to know that? You can ask the person move flexion, and then you can feel it. Okay, go down back. Alright, move up. Okay, go down. So the skill here, you need to do palpation. You need to feel it. Okay, how to feel it? Let me show you. Maybe it's easier for me to show you using these skeletal dummies. So because from here it's difficult to see where exactly the landmarks, the body landmarks that you have to do palpation. But from this skeletal, it's much more clear because you see this is your hip bones. Okay, so what I say here, the palpation should go perpendicular straight. Okay, straight. This is your GT, they call it greater trochanter. So you slightly go to down. So this is the most outer part of your bone. Okay, class? Okay, nice. So the most outer or the most outside, the medial side of your close to the greater trochanter, that you have to place your goniometer. Okay, this is where you have to place. Okay. Alright, this is how you put in place like this. So from this image, from this person, so basically how to know and how to feel it. So as I mentioned, you have to do perpendicular straight to the bone. So from here, I put either my palm or you can use my finger like this. I can feel it. How to confirm this? You can ask the person to slightly follow your movement. Yep. This is I can feel it clearly, and then go to the side. So yeah, okay, confirm. This is slightly outer of the trochanter. Alright, so where we're going to place these goniometers. Okay, so as I mentioned here, remember that the person will be like this. Okay, so the fulcrum of the goniometer should be the center, really perpendicular to the place where you palpate initially the greater trochanter. So as I mentioned earlier, you know that this is for movement, this will be static. So it should be perpendicular, it should be really the same angle with the femur bones. So you can do two ways. Number one, either you want to ask the person to do full level, or they can do like like this. Okay, short level. So I prefer to record in both ways. Why? Maybe the compensation you can get much more findings instead of you choose one, because you know, movement can be differences because of, you know, when you have long level, more gravity here compared to short level. So more level give more compensation deficit, so you can get more clear picture. Okay, so from here you can record. Okay, after angle of, for example, like the person move like this. Okay, you can ask the person, okay, I want you to move as much as possible without using any part of the body. Okay, only use your quadriceps and also your lower limbs. Okay, maximum. Okay, so put down back. I want you to do again. You can, okay, you can go now. So, okay, and stop. So he stopped. You can see from 0 to 54 angle, degree of angles. Okay, so you can record this. So basically, because this person has no injury, so you can see no compensation. So it could be the compensation just because of he has some big tummy, okay, and big muscles as well. So that's why you can see the range of movement have been not fully reached. But okay, you can see now the long level is 54 degree of angles. Okay, you can record that for first trial, and you also can test. Okay, we go with short level, so you can ask the person. So you can ask the person slightly maybe you can stand up. Sit down close to the bench. Okay, so and then you can ask the person to lie down again. So you can see that now you want to ask the person to move the hip flexion. Okay, move the hip flexion actively like this. So then you can see that there will be no support from the other table. So make sure when the person start, go and then touch the feet. So there will be no more active. It's already passive. So passive, it can go more degree of the joint. Alright. So I want you to move as much as you can. Alright. Okay, stop. So you see 72 degree of angle. So now because of first, of course, when you do like this, a lot of muscles also involved. Some resistance due to constant gravity pressure, so you have limited range of motion. But what you want to see here, you can make comparison between side to side, because I believe that you learn with other subjects for injury. You can choose, you can make comparison between injured limbs versus non-injured limb. But I believe this person is not. Do you have an injury? ACL. So we don't measure which leg?
Left side.
Left side. So we have ACL here. So you can see that if I try another one here with long level, so you can see maybe you can go beyond than 45, 54. Because of he has when last time you have ACL? 2016. But still we have we made what you call that recovery only, not recon, no construction. Okay. So he carries some recurrent injury maybe many years ago, but still because of the injury, the person will feel, you know, keep feeling that if I move more, I will get another injuries, or maybe my injuries will come back. So I think that kind of feeling is happened to everyone when you have past injury or history with chronic injuries. Okay, so that is the hip flexion. So you can choose either short or long level, but you can try both, because for me it will give you more information. But what I want to tell you, it's not just measuring, it's not just recording this. You need also at the same time when you move, you ask person move, I want you to see whether there are some other signs that you can record as well. For example, like as I said, compensation, the feeling of the person. Sometimes you can see the face. So you can put in the record, okay, at the 54 angle of the joint, the person struggling or feel pain. You can ask, do you feel pain? Yes, I feel pain when I go beyond than that. So you can record that, because the record, it will help you when you want to compare pre and post. Okay, that is example for hip flexion. So what kind of other movement for hip beside flexion? There will be extension. So you can ask the person to turn around. Now we continue with the second movement, which is hip extension. So from hip extension position, you can ask the person to turn around, lying down on tummy. Okay, so this is the best position. So will be the same. What you need to do, you need to find the GT or the tetrahedra of the bones. So the most outer side. Okay, this is one, because the person, this is second person, which is much more lean and thin compared to the second person, which is much more mass, big muscles. So you need to really palpate in the correct way. Okay. Before that, before we start using goniometer, what you can do, you can ask the person to move, because the most important here, the person will have a clear instruction from you. So now I will ask you to move your right leg, moving your leg like this. Okay. Make sure your knee is fully extended like this, and then your feet, your toe is pointing forward, downwards like this. Okay. So when I want you to move, okay, I don't want any compensation on the left side of the body. Okay, let's try first. Okay. So you see, when you give a clear instruction, there will be no too much compensation like this. Some people make mistakes, so they just record without giving a clear instruction. So I want you only move your right leg, go up as much as possible without using any compensation. If let's say there will be compensation when they move like this, so meaning that that is not the correct active range of motion. So bring up and slightly down. So up again. So this is the best, I think the best effort that the person can perform active range of motion for hip extension. So again, put back, using the goniometer, make a correct palpation directly to the outer side of the greater trochanter. So it's clearly this is the one. Alright, and then again, there will be no movement for this one, only this. Make sure, alright, I find the correct joint now. So I will ask you to bring up and then hold for a few seconds. Okay? Are you ready? Okay, ready, and we can start now. So you can see here, thank you, is 37 degree of angle for this hip extension on the right leg. Okay, so you can choose. There will be the same method. The person can do like this, and the position of the goniometer will be the same. So I hope it's clear to you before we go for the third movement. Okay, class? Done. Alright, class, we go for the third movement. So the third movement, I think you can get a close up here. So the most tricky one, because you need to make sure that the person will move like this. Okay. Without your support, then you can consider as active. So maybe you can ask the person to move. I want you to move. Okay. All your leg go outside, so and then bring it back. So you can see now it's a lot of what do you call that, compensation movement from the hip. Take a closer look. Okay, go slowly. So you see the person are not performing a correct way of abduction. Okay, go up. See, the person perform more externally rotated on the abduction side. So make sure that it could be the person who really have valgus knee, could be, I'm not sure. I will have to do a postural assessment, but that is not what we want from here, because if the person start perform compensation movement a lot, then it's not counted as considered a normal active range of motion, because you can see that if I have a lot of external or what you call it as compensation movement, then my movement are not correctly being assessed. So make sure that the person are not really use other muscles. So I can see that from this assessment, even though we're not measuring yet, I can see that there's a lot of some tightness, imbalances in terms of flexibility between these muscles, between the side of this muscle. That's why when we ask a person to move the leg up, see, so we start bringing this also together, because the muscle here are not flexible. So what happened to the muscle here? They start to pulling the muscle to support the movement. So this one is very important. It's very critical when you assess the person active range of motion. So before we go further, palpation for this joint are very what do you call that, difficult to do if you don't understand what are the joint that you want to palpate, because you need to make sure every time I say using goniometer, this will be the fulcrum. The fulcrum is the joint. So for the hip abduction, what are the joint that you want to put this? Because now you can see that this is the what you call it, the hip joint. So how can you place this one perform the abduction. So you need to find the best bony landmarks. For me, if I according to William E. Prentice books, we can use axis as our bony landmarks. What is axis? Axis is what we call it anterior suprailiac spine. Okay, you can see that. This is how we determine differences between sex, either you are female or male. So you can see that a male, they have a more, what do you call it, small hip compared to a woman who have bigger hip, because they carry, you know, where the baby will be placed in the womb. So the guy, you can clearly, for example, this person are very thin. When I put my palm like this, I can feel it, the anterior suprailiac spine, or they call it axis. So this is what we call anterior suprailiac spine. When I place my palm like this, and then I know this is my anterior suprailiac spine. So I will place the fulcrum like this, pointed up, perpendicular down to the knee. So as I mentioned earlier, this will be not moving. So when the person we ask to move, abduction like this, so this will not moving. So you can see that we are moving only one arm. So we can measure the abductors muscles of the hip. Okay, class. Let's start assess the person abductors. Okay, as I mentioned earlier, we put this. Okay, make sure will be the midpoint of your femur, the quadricep or femur bone. So we will ask the person, make sure feet pointed upwards, so the person can move outside as much as you can, slowly. So compensatory, so slightly up. Yes, that is the range of movements for him on the left side. So when I mark here. So you can see on the left leg, the abductors angles is 36. Okay, 36. So what muscles basically that you want to measure? You are bringing it out for measuring. Is that this muscle, abductors or abductors or adductors? So remember, when we go abduction like this, we are measuring the muscle on adductors. Okay, so same will be when you go in other way around. So if you want to measure abductors, you go adduction movement. Okay, that's how we use the simple analogy. Alright, okay class. Alright, let's move on. So the next assessment for the active range of motion will be adduction. Adduction means the person have to move inside, okay, like this. So will be tricky because outside, yes, you can just place here and then the person can move outside, but to go inside you have to make some adjustment, especially on the opposite leg. So I'll always use this technique. The person can do like this and then hold it, so then you can able to move, the person can able to move the leg inside, okay, without any assistance. So it gives much more range of motion to complete while the person lying down with the leg bringing up like this. Okay, there is another way, but that way I think it's quite difficult if the person will have back injuries, which is I don't want to show here because I think it's quite dangerous as well, because you're going to make a mistake when the person that having now here is really healthy, no injuries, you have no aggravate pain at the moment, so you can do that. But just imagine if you have someone who have really injury or pain on that time, and you make a mistake, you will aggravate more pain. Okay, so how to do this? Okay, you can ask the person to hold. Do not hold like this because it's going to put some pressure on the kneecap. Go underneath. like this, it's much more easier. So you can, why we do not want the person to just roll inside like this? There will be no active because they will get support from the bench, so the movement will be no longer active. So that's why I will ask the person slightly up, yes, and then go inside. Okay, all right. So where to place this? Okay, again, find the iliac crest. Yeah, this is the iliac crest. Okay, put on the fulcrum so you can relax. So when I say okay, I'm ready and you ready, slightly up and then bring it inside as much as possible. Okay, good. Okay, thank you. You can see that 34. Okay, 34, 33, something like that in the middle. Okay, this is how we can measure first abduction, second is adduction. Adduction means go inside. So meaning that we try to get measurement of the abductors range of motion or flexibility muscles. Although we are performing adduction, but we're not measuring adductors. We are measuring abductors. Okay, it's go like that way. So I hope you guys clear on this. All right, we to almost end of the assessment, which is external rotation and also internal rotation of the hip. So this position is quite different. So the person has to be lying down like this because we want to perform like, how can we perform external rotation of the hip? So this is internal, opposite way, because the position will be, because he's in this position. So when you ask a person to go like this, so it's like opposite direction, meaning that it's internal. This will be external. Okay, you can feel it. So maybe you don't clear what is external and internal, but I will ask the person to lie down on your back. Okay, so if I go like this, so you want to see external, this is external. Go inside, this is internal. Okay, but to measure like this, I think would be not pragmatic to put goniometer in the position like this. So we have to bend the knee. Okay, bend the knee like this, so you can place it here. However, I will not recommend it in this position, because when you go like this and you go like this, because in this position a lot of compensation will involve, especially the hip on this side and also on this side. So I will always recommend it that all of you go in the lying down on the tummy position, right? Okay, so we ask them to go back to this position. So we'll ask the person to do a knee flexion position, and then the goniometer should be in the knee, which is the mid of the kneecap. Do not flex too much, relax, because you will ask the person to basically move. Either don't leave it, just go either outside or go inside. So outside here refers to internal rotation, and inside is external rotation. Okay, all right. So where to place this? Again, make sure it should be in the mid of the knee like this. Okay. All right. So we're going to ask the person to move outside first. Okay, bring the feet outside. So you move like this. Go like this. All right. The other part of the body do not move. Okay. Ready? Ready and go now. Okay. All right. This is common mistake. The person when to move, they lift and then move. No. Stay there. Just move as you can. And I think that is the best range the person can do. Okay. We do it again. So to ensure that this is the correct way of doing the measurement. Okay, are you ready? Ready and move. Okay. So go outside. For internal rotation, he perform about 15, yes. Okay, now we ask the person to go to inside. Okay? So do not move your leg, do not move your feet too much, because we do not want to have a lot of compensatory movement from the other joints. Okay, ready? And move. I think he's performed 54. So you can make comparison on this side, okay, to see whether there are differences or not. So I think we have complete all tests for hip active range of motion. I will share with you about some tables, or we use that tables to know whether the person have a healthy range of motion. So then you can make a comparison whether the person on this side, on that hip movement having some issues with flexibility, which you can correct with exercise. Remember one thing, exercise, there are many forms, but what we are performing today, assessment on flexibility. So you want to put some flexibility exercise where you find some movement that are not normal due to muscle tightness, due to muscle pain, and also due to some injuries on that region. So how can you improve the muscles muscle tightness using flexibility exercise? Okay, thank you so much.